The emergency room at St. Mercy Medical Center in Chicago didn't just have an atmosphere, it had a weather pattern. Most nights, it was a low-pressure system of constant, grinding drizzle, minor fractures, fevers, and the endless parade of urban malaise. But everyone knew that at any moment, a hurricane could make landfall through the ambulance bay doors. At 2:00 a.m. on a Tuesday, the weather was currently being dictated by Dr. Mason Hale. Dr. Hale was the chief trauma surgeon, a man whose brilliance in the operating theater was matched only by the absolute zero temperature of his bedside manner. He was tall, impeccably groomed even after a 12-hour shift, and possessed laser-sharp blue eyes that could dissect a resident's confidence faster than a scalpel through tissue. He didn't just demand excellence, he scorched the earth beneath anyone who offered anything less. Dr. Evans. Hale's voice cut through the ambient noise of monitors and rolling carts like a whip crack. He was standing over a terrified second-year resident who was fumbling with a portable ultrasound machine. Are you attempting to locate the spleen, or are you simply giving this patient's abdomen a shiatsu massage? You have 10 seconds to find free fluid before I assume you skipped anatomy class entirely. The resident turned pale, his hands shaking so badly the image on the screen looked like static. I think I see it, Dr. Hale. Right quadrant. Wrong. Hale snapped, snatching the probe from the young doctor's hand. With 2 fluid movements, he adjusted the gain on the machine and slammed the probe onto the patient's side. The screen instantly cleared, showing a dark, ominous pocket around the liver. Morrison's pouch, full of blood. You just wasted 3 minutes of this man's life. Get him to OR 2, now. And don't speak to me until you've reread the entire trauma protocol manual. As the crushed resident scrambled away, pushing the gurney, Hale let out a sigh of theatrical exhaustion. He turned, ready to find his next victim, and found himself facing the charge nurse desk. Standing there was someone he hadn't seen before. She didn't look like the usual fresh-faced graduates who arrived at St. Mercy, with idealistic gleams in their eyes, destined to be extinguished within a month. Nor did she look like the hardened veterans who wore their exhaustion like armor. Ava Brooks stood with perfect stillness amidst the swirling activity of the ER hub. Her dark blue scrub uniform was immaculate, creased sharply. Her hair was pulled back in a practical, severe bun, revealing a face that was calm, almost serene, with watchful brown eyes that seemed to take in the entire room without moving. She held a clipboard not as a shield, but as a tool. "Who are you?" Hale demanded, not bothering with pleasantries. "Ava Brooks," she replied, her voice low, distinct, and utterly unaffected by his aggressive tone. "I'm the new night shift charge nurse for trauma." Hale let out a short, derisive scoff. "Another one? Did they run out of warm bodies in pediatrics? Listen, Ava, this isn't a holding area. This is the deep end. If you can't swim, stay out of the water. My residents are incompetent enough. I don't need nursing staff who require hand-holding." He expected her to flinch. They always flinched. Ava didn't blink. She stepped forward, closing the distance between them, invading his personal space just enough to force him to look directly at her. "Dr. Hale," she said. It wasn't a question. It was a statement of identity. "I've reviewed the board. We're short 2 RNs. The CT scanner in Bay 3 is recalibrating, and you have 4 pending consults that are bottlenecking the flow." Hale stared at her, momentarily thrown off balance by her immediate grasp of the logistics. "And your point is?" "My point is that I'm not here to hold hands, doctor. I'm here to ensure your hands can do their job without obstruction." She glanced around the disorganized central desk, where charts were piled high and phones were flashing unanswered. "Give me 15 minutes, she said. Hale looked at her as if she had just asked for a pony. "Excuse me?" "Give me 15 minutes uninterrupted to reset this floor's triage flow and reorganize the crash carts in Trauma 1 and 2. Then, you can return to insulting me. But for 15 minutes, I need you to step back and let me work." For 3 seconds, there was silence in the immediate vicinity. Several nurses nearby stopped what they were doing, waiting for the explosion. Then, Dr. Mason Hale threw his head back and laughed. It was a loud, harsh sound, devoid of humor. 15 minutes, he sneered, leaning down so his face was inches from hers. "Lady, in this ER, 15 minutes is an eternity. 15 minutes is the difference between a patient walking out of here and leaving in a bag. You think you can fix the incompetence of this hospital in a quarter of an hour? Be my guest. But when you fail, don't expect me to clean up your mess. He spun on his heel and stalked toward the coffee machine, already dismissing her. He didn't see the slight tightening of Ava's jaw, nor the way she immediately picked up the primary phone line, her eyes already scanning the waiting room monitors. He didn't know that 15 minutes was all she ever needed. Ava didn't spend her 15 minutes reorganizing paper clips. She moved with an economy of motion that was almost robotic, yet fluid. She didn't walk. She glided from station to station. First, the communication hub. She silenced 3 ringing phones, routing non-urgent calls to the answering service and prioritizing 2 consults from ICU. She located the backlog of lab results that were stalling discharges, printed them, and physically placed them in the hands of the residents, issuing quiet, direct instructions that brokered no argument. Next, the trauma bays. She threw open the crash carts. To the untrained eye, they looked fine. To Ava's eye, they were disaster zones. The laryngoscope blades were not sized in order. The intraosseous drills, the last resort for vascular access when veins collapsed, were buried beneath bags of saline. Her hands moved in a blur. Within 4 minutes, both main trauma bays were fundamentally reset. They were no longer just stocked, they were primed for rapid deployment. Every tool was exactly where a blindfolded hand would reach for it in a crisis. 12 minutes into her self-imposed deadline, the ambient noise of the ER changed. It wasn't a sound from inside the hospital. It was the distant synchronized wail of sirens, not 1 or 2, but many, approaching from different directions like a pack of wolves converging on prey. The red phone at the charge desk, the direct line to paramedics in the field, began to ring with the shrill, urgent tone that stopped everyone cold. Ava answered it before the first ring finished. "St. Mercy Trauma, this is Nurse Brooks. Go ahead." She listened for 10 seconds, her expression never changing, but her eyes hardening into flint. She grabbed a red trauma marker and turned to the large whiteboard that listed incoming patients. "Dr. Hale." Her voice projected across the room, cutting through the chatter not with volume, but with absolute clarity. "Mass casualty protocol. Now." Hale, coffee cup halfway to his mouth, froze. "What?" 5-car pileup on the I-90 involving a semi-truck and a commuter van. First bus is 2 minutes out. They have 6 critical, 4 yellow, walking wounded unknown. Start clearing bays, 1 through 4. Move the stable abdominal pain in bed 6 to the hallway. Notify blood bank we need O-negative coolers immediately. Page anesthesiology and tell ortho to scrub in. The speed at which she delivered the information, the precise triage decisions she had already made, stunned the room. "Did you hear me?" Ava said sharply, looking directly at the frozen staff. "Move!" The doors burst open. The first wave hit. It was an avalanche of noise, blood, and controlled panic. Paramedics were shouting vitals over the groans of patients strapped to backboards. The smell of copper, burnt rubber, and fear flooded the air. Male, 40s, driver of the van, crush injury to the chest, BP 80/50, heart rate 130, satting 88% on non-rebreather. A paramedic yelled, pushing a stretcher covered in trauma blankets. "Trauma 1, Ava directed, pointing. "Dr. Evans, that's yours. Get a chest tube kit open before he gets there. Female 20s, ejected from vehicle, open femur fracture, massive blood loss in the field, tourniquet applied at 02:15. Trauma 2, Ava commanded. "Dr. Patel, call the blood bank again. Tell them the cooler needs to be here 10 seconds ago." Hale snapped out of his momentary shock. He stepped into the center of the chaos, his ego reasserting itself. "All right, listen up. I want primary surveys done in 30 seconds. If they aren't dying right now, move them out. I want surgical airways ready in all bays." He looked around, ready to start barking orders at the new nurse, ready to see her overwhelmed, her 15 minutes exposed as arrogant posturing. Instead, he saw her in the middle of the whirlwind, a calm eye in the storm. She wasn't running. She was directing traffic with subtle hand gestures and concise words, catching problems before they became crises. A resident was about to hang the wrong fluids on a head trauma patient. Ava's hand gently but firmly intercepted the bag, replacing it with hypertonic saline without even looking at him. "Wrong osmolarity for cerebral edema, doctor. Use this," she murmured, already moving to the next bed. Hale felt a strange sensation, a flicker of irritation mixed with reluctant surprise. She wasn't drowning. She was swimming faster than the sharks. The golden hour in trauma medicine is the concept that critical trauma patients have less than 60 minutes from the time of injury to receive definitive care if they are to survive. Every minute wasted on indecision, lost equipment, or poor communication bleeds away their chance of survival. At St. Mercy, the golden hour was usually a chaotic scramble. Tonight, under Ava's quiet orchestration, it felt different. It felt like a grim, efficient ballet. But the sheer volume of patients was threatening to overwhelm the system. The hallway was lined with stretchers. The air was thick with the sounds of portable ventilators and the high-pitched alarms of cardiac monitors. Ava moved to the triage area near the doors, where the walking wounded were being seated. This was the most dangerous area in a mass casualty event. It was easy to focus on the screaming patients covered in blood, but the silent killers, internal bleeding, slowly collapsing lungs, often hid among those who looked stable initially. She scanned the faces of the people sitting in wheelchairs. A young man with a bandaged arm was loudly demanding pain medication for a fractured wrist. A woman was crying hysterically, clutching a bruised shoulder. Ava's eyes bypassed them and landed on an older man sitting quietly in the corner. He wasn't crying. He wasn't asking for anything. He was just sitting very still, staring at the floor, taking shallow, sipping breaths. His skin was a pale, waxy gray under the fluorescent lights. Educational note: in trauma, silence is often louder than screaming. A patient screaming in pain has a patent airway and enough brain perfusion to process anger. A quiet patient, especially one who is pale, cool, and clammy, may be in compensated shock. Their body is clamping down blood vessels to keep the brain and heart alive, masking a catastrophic internal hemorrhage until the moment they crash completely. Ava approached him slowly, kneeling so she was at his eye level. She didn't grab his wrist for a pulse. Instead, she placed a hand gently on his forearm. His skin was freezing. "Sir?" she asked softly. "What's your name?" He looked up slowly. His eyes were unfocused, pupils slightly sluggish. "Arthur," he whispered. I was just driving behind the truck. I think I hit the steering wheel. My stomach feels full." "Full," Ava repeated. It was a terrifying word in trauma. It usually meant the abdomen was filling with blood from a ruptured spleen or liver. She placed a hand lightly on his belly. It was rigid, board-like. His body was guarding a massive injury. "Arthur, stay with me," Ava said, her voice calm but laced with steel. She didn't yell for help. She stood up, caught the eye of two orderlies, and gestured them over with a sharp snap of her fingers. "This patient goes to Trauma Bay 3 immediately. Bump the ankle fracture out. He is category red. Now." As they began to move Arthur, Dr. Hale stormed past, wiping blood from his gloves. "Brooks, what are you doing moving a stable patient into a trauma bay? I have a femur fracture that needs reduction in there." "He's not stable," Ava said, moving alongside Arthur's stretcher. "He's compensating. Rigid abdomen, cool extremities, altered mental status. He's bleeding out internally. If we wait for his blood pressure to drop, he's dead." Hale stopped, looking at the quiet, gray man on the stretcher. He realized, with a jolt of cold dread, that he had walked past this man twice in the last 10 minutes and dismissed him because he wasn't making noise. He looked at Ava. There was no triumph in her eyes, only focused urgency. "Get him hooked up," Hale barked at the orderlies, his tone shifting instantly. "Fast scan ultrasound to the abdomen. Type and cross for 4 units. Now!" He followed Ava into the bay. As they transferred Arthur onto the trauma bed, his eyes rolled back in his head. The monitor erupted in a frantic alarm. His heart rate skyrocketed, and his blood pressure crashed from a compensated 110/70 to a critical 60/40 in seconds. "He's crashing," a resident yelled. "Where's the fluid?" Ava was already hanging a pressure bag of O-negative blood on the IV pole. She had anticipated the crash by 30 seconds. She handed the ultrasound probe to Hale before he even asked for it. Hale slammed the probe onto Arthur's abdomen. The screen went black, not from malfunction, but from fluid. Massive amounts of free blood. Ruptured spleen, grade 4 or 5, Hale muttered, his mind racing through surgical protocols. We need the OR now. He won't survive the elevator ride if we don't stabilize him. He looked up. Ava was already on the phone with the OR charge nurse, giving a concise, perfect report. Trauma 3 coming up. Ruptured spleen, hemorrhagic shock. We are rolling in 2 minutes. Have the rapid infuser ready. She hung up and looked at Hale. OR is ready, doctor. The 15 minutes are up. We need to move. For the first time all night, Dr. Mason Hale didn't have a sarcastic retort. He just nodded, a tight, jerky movement. They ran alongside the gurney toward the elevators, a silent, synchronized team, leaving the chaos of the ER behind for the sterile intensity of the operating room. Ava had been right. 15 minutes had made all the difference. The doors to operating room 2 swung open, and the atmosphere shifted instantly from the humid, frantic noise of the ER to the frigid, sterile silence of surgery. The air conditioning hummed a low, aggressive drone, keeping the room at a shivering 62 degrees Fahrenheit, optimal for keeping bacteria down and surgeons from sweating, but brutal for a patient in shock. Arthur, the man whose quiet demeanor had nearly masked his death warrant, was now a landscape of blue drapes and betadine. "Get him on the table," Hale commanded. He was already scrubbing, the water hitting the stainless steel sink with violent force. "I need a lap pack open. If his pressure drops below 60 systolic, clamp the aorta. Do not wait for my permission." Ava didn't scrub in to operate. That was the surgeon's domain. But she assumed the role of the circulator with a terrifying efficiency. In an OR, the circulating nurse is the conductor. They don't touch the patient. They control the environment. They are the eyes that see what the surgeon, tunnel-visioned into a cavity of blood, cannot. Anesthesia is induction complete. The anesthesiologist, Dr. Morris, called out, his voice tight. "Pressure is soft, 70/40. We are behind on volume." "He's bleeding faster than you're pumping," Ava said. She wasn't asking. She was already at the rapid infuser, a machine capable of warming and pumping blood into a patient at pint-per-minute speeds. "I'm starting the second unit of O-neg." "Pressure bag is up." Hale stepped up to the table, gown and gloves donned in seconds. Scalpel. The blade moved, skin parted, and the reality of Arthur's condition revealed itself. It wasn't just a trickle. The moment Hale entered the abdominal cavity, blood welled up like oil striking a geyser. The suction canister hissed, filling with bright red fluid instantly. "Can't see," Hale grunted, his hands moving blindly into the pool of warm blood, feeling for the pedicle of the spleen to clamp it off. "Suction! More suction!" "Suction is maxed out," the scrub tech stammered, freezing. Hale cursed. "I need visibility, damn it! If I clamp blindly, I take the tail of the pancreas with it." This is the nightmare of trauma surgery. The anatomy is distorted by hemorrhage. You are working in a dark room filled with red ink. Ava saw the problem before it happened. She didn't shout. She grabbed a second suction setup from the back wall, something she had checked during her 15 minutes downstairs, and connected the tubing in 3 seconds flat. She didn't hand it to Hale. That would break the sterile field. She tossed the sterile end of the tubing perfectly onto the sterile tray near the tech's hand. "Second line. Hook it up. Now," she commanded the tech. The tech snapped out of his freeze, grabbed the second suction tip, and dove in. 2 lines working in tandem cleared the field just enough. "I see it," Hale whispered. "Hilar vessels are shattered." Clamp. The metal click of the hemostat echoed in the room like a gunshot. Then another, then a third. The welling of blood stopped. "Got it," Hale exhaled, his shoulders dropping half an inch. "Splenic artery is clamped. We have control." The room collectively decompressed. The anesthesiologist let out a long breath. "Pressure is coming up. 90/60. Heart rate stabilizing." For the next hour, the surgery became a routine splenectomy. But Hale found himself distracted. Not by the procedure, his hands could do this in his sleep, but by the rhythm of the room. Usually he had to ask for things. More light. Adjust the table. Where are the 4-4 sponges? Tonight, the moment he thought, "I need the table," tilted Trendelenburg to move the intestines out of the way, The table began to tilt. He looked up. Ava was at the controls, watching his hands, not his face. She anticipated the mechanical needs of the surgery based on the angle of his instruments. It was uncanny. It was the kind of synergy usually shared by surgical teams who had worked together for a decade, not strangers who had met an hour ago in a shouting match. When the last staple was placed and the dressing applied, Hale stripped off his bloody gloves. He looked at Ava, who was already counting sponges with the tech to ensure nothing was left inside the patient. "You've been in an OR before," Hale said. It wasn't a question. Ava didn't look up from her clipboard. "I've been in many rooms, doctor. The anatomy doesn't change just because the zip code does. You anticipated the second suction. You knew I was going for the pancreas check before I said it." Hale walked closer, his mask hanging off one ear. "Nurses don't learn that in nursing school. Residents don't learn that until year 4. Ava finally looked at him. Her face was tired, pale under the harsh lights, but her eyes remained unreadable. "Good nurses learn to watch the hands, Dr. Hale. The hands tell the truth. Your hands were hesitant. You were looking for the tail. I just cleared the road." She turned to help transfer Arthur to the recovery bed. "Nice save on the spleen, by the way," she added, almost as an afterthought. Most would have waited for the blood bank and lost him. It was a compliment. Coming from anyone else, Hale would have preened. Coming from her, it felt like a performance review, and the terrifying part was, he felt relieved that he had passed. By 5 a.m., the weather in the ER had calmed. The pile-up victims were stabilized, admitted, or discharged. The floors were mopped, smelling of bleach and coffee. The adrenaline dump is a real physiological phenomenon for medical staff. After hours of cortisol pumping through your veins, the body crashes. Hands shake, tempers shorten, and the silence feels heavier than the noise. In the staff break room, the rumors were already festering. Medical professionals are gossips by trade. It's a coping mechanism. They analyze people like they analyze symptoms. "I heard she did a tracheostomy in the elevator," a first-year resident whispered, leaning over a stale bagel. "She didn't do a track, you idiot," a senior nurse corrected, pouring lukewarm coffee. "But she did call the aortic rupture on the guy in Bay 4 just by looking at his neck veins, before the CT scan." "I pulled her file," the unit secretary chimed in, lowering her voice. "Or I tried to." The room went quiet. "What do you mean, you tried to?" Dr. Hale stood in the doorway. He hadn't meant to eavesdrop, but his curiosity was itching like a rash. The secretary jumped. "Oh, Dr. Hale, Well, usually new hires have a thick digital file. Certifications, past employment, references from local hospitals. Ava Brooks, her file is thin." Hale walked over, grabbing a bottle of water. "Define thin." "Agency papers," the secretary said. "She's a traveler, floating contract. Her previous location is listed as Doctors Without Borders, various assignments. Before that, a hospital in Seattle that closed down 5 years ago. It's all verified. Her license is clean, but there's no personal history, no social media, no About Me section." Hale frowned. Travel nurses were common, mercenaries of the medical world who moved from city to city for high pay. But they usually came with baggage. They were burnout cases chasing money, or young adventurers looking for excitement. Ava Brooks didn't fit either profile. She moved with the weary precision of a veteran soldier, not a mercenary. "She's hiding something," the resident muttered. "We all are," Hale snapped, suddenly defensive. "Get back to work, unless you want me to quiz you on the Krebs cycle right now." The residents scattered. Hale remained in the break room, staring at the empty coffee pot. He thought about the 15 minutes she had asked for. It was a bold, arrogant move, but she had delivered. She had turned his chaotic, failing ER into a machine. Educational note: high-functioning medical teams often suffer from tall poppy syndrome. When a new member outperforms the established hierarchy, the group's instinct is often to cut them down rather than learn from them. This toxic culture is a leading cause of medical errors, as ego takes precedence over patient safety. Hale walked out to the nurse's station. Ava was there, restocking a cart. She looked fresh, as if she hadn't just spent 4 hours in a bloodbath. "Who are you really, Brooks?" Hale asked, leaning on the counter. He kept his voice low, intimate but probing. "I told you," she replied, slotting vials of epinephrine into a drawer. "I'm the night charge nurse. You handle a trauma bay like a combat medic. You anticipate surgical moves like a chief resident, and you have the file of a ghost." Hale narrowed his eyes. "Are you a doctor who lost her license? Is that it? Playing nurse because you can't cut anymore?" It was a cruel question, designed to provoke a reaction. Ava stopped. She placed the vial down slowly. She turned to him, and for a second, Hale saw a flash of profound sadness behind the steel barricade of her eyes. "Dr. Hale," she said softly, "titles are just words we use to justify our egos. I don't care about the letters after my name. I care that Arthur is waking up in the ICU right now instead of cooling in the morgue. If that bothers you, maybe you should ask yourself why you need everyone to be beneath you to feel tall." She picked up her clipboard and walked away, heading toward a call light down the hall. Hale stood there stunned. He had tried to dissect her, and she had just handed him a mirror. He decided then and there. He wasn't going to fire her. He was going to break her. He was going to give her a case that 15 minutes of organization couldn't solve. A case that required pure, raw medical intuition and emotional endurance. He checked the tracking board. An ambulance was 5 minutes out. "Pediatric fever," the note read. "Complex history." Hale smiled, a cold, sharp expression. "Let's see how you handle this, Ava." The sun was barely up when the next challenge arrived, and it was the kind that made even veteran nurses flinch. It wasn't a bloody car crash. It was a 7-year-old boy named Leo, carried in by a father who looked like he was about to punch a hole in the wall, and a mother who was sobbing quietly. "Don't touch him," the father roared as a triage nurse tried to take the boy's temperature. "Every time you people touch him, he screams. We've been to 3 hospitals in 3 days. Nobody knows what's wrong. They just say virus and send us home." The boy, Leo, was curled in a fetal position on the gurney. He was miserable. His skin was blotchy, his lips were cracked and bleeding, and he was burning up with a fever that radiated heat you could feel from a foot away. Dr. Hale stepped in. "Sir, calm down. I'm Dr. Hale, Chief of Trauma. If you want us to help, you need to step back." "Help!" the father spat. "You're all the same. You'll give him Tylenol and bill me $2,000. Hale's patience, never abundant, was fraying. He turned to Ava, who had just arrived at the bedside. "Brooks," Hale said, his voice loud enough for the parents to hear, "this is your patient. History, vitals, and line. Get control of the family. I'll be back in 10 minutes to see what you've found. Don't disappoint me." He walked away. It was a setup. Dealing with aggressive, sleep-deprived parents of a chronically ill child is the hardest task in the ER. He expected her to call security. He expected her to fail to get the IV. Ava didn't look at the father. She looked at Leo. She lowered the side rail and sat on a stool, bringing herself below the father's eye level, a psychological de-escalation tactic. "He hurts everywhere, doesn't he?" Ava asked the mother softly. The mother nodded, tears spilling over. "He won't eat. He says his throat burns. And his hands. Look at his hands." Ava gently lifted the boy's hand. The skin on his fingertips was peeling, coming off in sheets. She looked at his eyes. The whites were injected with blood, red and angry, but there was no pus, no discharge. She looked at his tongue. It was bright, strawberry red. Educational note. In pediatrics, pattern recognition is key. A fever lasting more than 5 days, combined with a strawberry tongue, peeling skin on extremities, and non-purulent conjunctivitis, red eyes without goop, points to a specific, dangerous, and time-sensitive diagnosis. "How long has the fever been high?" Ava asked. 6 days, the father said, his aggression deflating into exhaustion. "It won't break." Ava stood up. She didn't try to start an IV immediately. She didn't fight the father. She poured a cup of ice water and handed it to the dad. "Drink," she said. "You're dehydrated, and you need to be strong for Leo." The father blinked, surprised by the act of care directed at him. He took the cup. "I need 15 minutes, Ava said to them. "Not to fix him, but to prove to you that we know what this is. Can you give me that?" The father nodded slowly. Ava walked out to the station where Hale was watching from a distance, arms crossed. "Well?" Hale asked. "Did you call security?" "No," Ava said. "I need an echocardiogram, now. And high-dose aspirin and IVIG, intravenous immunoglobulin." Hale laughed incredulously. "IVIG? That's a $10,000 drug. You want to order that for a viral fever?" "It's not viral," Ava said, her voice dropping to a whisper so only Hale could hear. "Fever for 6 days. Strawberry tongue. Desquamation of the fingertips. Bilateral conjunctival injection. He's irritable because his blood vessels are inflamed." She locked eyes with Hale. "It's Kawasaki disease, doctor. And we are on day 6. If we don't treat him within the 10-day window, he has a 25% chance of developing coronary artery aneurysms. He could have a heart attack at age 7. Hale stared at her. He looked back at the boy. The peeling fingers, the red eyes, the classic presentation that 3 other hospitals had missed because they were too busy looking at the virus label to look at the patient. Kawasaki disease is rare, but misdiagnoses are the leading cause of acquired heart disease in children. Hale felt a chill. If he had sent this kid home with Tylenol, which he probably would have given the generic triage note, the boy could have died a week later. "Are you sure?" Hale asked, the arrogance gone. "Look at his tongue," Ava challenged. Hale walked into the room. He asked Leo to open his mouth. He saw the inflamed, bumpy redness. He turned to the parents. "Your son has Kawasaki disease. It's an inflammation of the blood vessels. We can treat it, but we have to start right now to protect his heart." The mother collapsed into a chair, sobbing with relief that someone finally had an answer. The father grabbed Hale's hand, shaking it violently. Thank you, doctor." Hale felt a pang of guilt. He hadn't found it. Ava had. He looked over the father's shoulder. Ava was already on the phone with the pharmacy, ordering the IVG. She wasn't looking for credit. She was doing the work. Hale walked back to the station, his world tilting on its axis. She wasn't just a good nurse. She was a diagnostic machine. "Brooks," Hale said as she hung up the phone. "Yes, doctor." "You didn't just study nursing," he said, his voice low. "You know pathology. You know rare presentations. Why are you here? Why St. Mercy? Why the night shift where nobody sees you?" Ava paused. For the first time, her mask slipped. She looked at her hands, clean now, but she seemed to see something on them. "Because the night shift is where the mistakes happen," she whispered. "And I have a debt to pay." "What debt?" Hale pressed. Before she could answer, the lights in the hospital flickered. Once, twice, then total darkness. The hum of the ventilation died. The monitors beeped in protest, switching to battery power. "Generators?" Hale asked, looking up at the black ceiling. A red emergency light buzzed on down the hall, casting long, eerie shadows, but the main power didn't kick back. "The storm," Ava said, looking out the sliding glass doors. "The grid is down, and the backup generators, they didn't cycle on immediately." Hale looked at the board. They had a patient on a ventilator in Bay 2. They had Arthur in the ICU on life support. They had Leo needing a complex infusion. "We have no power," Hale realized, panic rising in his chest. "No CT, no labs, no lights." Ava grabbed a flashlight from her pocket, clicking it on. The beam cut through the dark, illuminating her face. She didn't look scared. She looked ready. "We don't need power, doctor," she said. "We have hands, we have ears, and we have 15 minutes before the batteries on the vents die. Let's go." Hale found himself nodding, following the beam of her light into the darkness. The test was over. The war had begun. The darkness wasn't the problem. The silence was. In a modern hospital, life is a symphony of electronic affirmation. The beep of the EKG says, "I am beating." The whoosh of the ventilator says, "I am breathing." The hum of the infusion pump says, "I am medicating." When the grid failed and the backup generators choked, that symphony died. It was replaced by the terrifying organic sounds of human struggle, the gasp of patients waking up in the dark, the scrape of chairs, the rising murmur of panic. "Nobody move!" Hale's voice cracked slightly, echoing in the black hallway. "Stay where you are until we get emergency lights." A beam of light cut through the gloom. Ava was standing on the central desk holding a heavy-duty tactical flashlight. She looked like a lighthouse keeper in a storm. "Listen to me," she projected, her voice calm but booming. "The vent batteries have 20 minutes of life. The infusion pumps have 15. We don't wait for the generators. We switch to analog protocol." The residents looked up at her, their faces illuminated by cell phone lights, looking like frightened ghosts. "What is analog protocol?" a junior nurse asked, trembling. "We become the machines," Ava said. She jumped down. "Dr. Evans, take 2 interns to the ICU. You are now the ventilators. You will handbag every patient who is intubated. 1 breath every 6 seconds. Count it out loud. 1, 1,000. 2, 1,000. Squeeze. Do not hyperventilate them, or you will drop their blood pressure. Go." She turned to the next group. "Nurse Miller, grab the crash cart. We need to manually drip meds. Forget the pumps. We count drops. 60 drops is a milliliter. Calculate the drip rates for the pressors. Do it on paper. Do it now." Hale watched her. He was the chief of trauma, the captain of the ship, but he felt like he was watching a general command a battlefield he didn't recognize. He was used to robotic surgery and CT reconstructions. He had forgotten how to count drops. "Dr. Hale," Ava said, appearing at his side. She handed him a headlamp she had fished out of a disaster kit. "Put this on. We have a problem." "Which one?" Hale asked, strapping the light to his forehead. "The elevators," Ava said grimly. "They didn't just stop. They jammed between the ER and the labor and delivery floor. Security says there's a woman inside. She was being transferred for an emergency C-section. Fetal distress." Hale felt the blood drain from his face. "If she's stuck between floors, we can't get her out. Fire rescue will take 20 minutes in this storm." "We don't have 20 minutes," Ava said, already moving toward the elevator bank. "I heard the radio chatter. She's eclamptic. She's seizing." The elevator doors were a jagged mouth, pried open just 6 inches by a crowbar the security guard was straining against. Through the gap, about 4 feet off the ground, they could see the top half of the elevator cab. The space was tight, hot, and smelled of ozone and urine. Inside, a nurse was hunched over a pregnant woman who was convulsing violently on a stretcher. "She's biting her tongue," the nurse inside screamed. "I can't get the line in. It's too dark." Hale peered through the gap. "We need to get her out. Pull her up." "We can't," the guard grunted. "The cab is off the rails. If we shift the weight too much, the brake might slip. It could drop to the basement." Hale froze. Operating in a sterile room with backup power was one thing. Crawling into a suspended metal box that might plummet 5 stories down was another. His survival instinct screamed at him to wait for the fire department. "Dr. Hale," Ava said. She was stripping off her scrub jacket. "Hold the doors. What are you doing?" "I'm going in." "She needs magnesium sulfate for the seizure, and she needs the baby out. Now." "You can't do a C-section in an elevator," Hale shouted. "It's insanity. It's malpractice. You'll kill them both." Ava stopped. She looked at him through the beam of his headlamp. The baby's heart rate was 60 when they left the floor. That was 5 minutes ago. If we wait for the firemen, we are delivering a corpse. Are you coming, or am I doing this alone? She didn't wait for an answer. She slid through the gap, dropping down into the cab with a heavy thud. Hale stood there, his heart hammering against his ribs. He was a surgeon. He was a god in the OR. But here, he was just a man afraid of the dark. Educational note: eclampsia is a life-threatening complication of pregnancy, characterized by high blood pressure and seizures. The only cure is delivery of the baby. Every minute the mother seizes, the placenta clamps down, cutting off oxygen to the fetus. He heard Ava's voice from inside the shaft. "I have the line. Pushing mag. She's post-ictal. She's stopping. But the fetal tones are gone. I can't find a heartbeat with the Doppler." Silence. Then Ava's voice, sharp as glass. "I'm cutting. I have a scalpel in my pocket kit. I'm doing a crash section." That broke him. Hale couldn't let a nurse, no matter how brilliant, cut open a patient in a dark elevator with a pocket knife. His ego, his pride, and his oath finally aligned. "Wait!" Hale yelled. "Don't cut yet!" He grabbed a trauma pack from the floor, squeezed through the gap, and dropped into the elevator next to her. The space was claustrophobic. The heat was intense. The patient, a terrified young woman named Sarah, was barely conscious, groaning. "Hold the light," Hale commanded, his hands shaking slightly, then steadying as he touched the patient's skin. "If we do this, we do it fast. Splash the betadine. Just pour the whole bottle." Ava uncapped the bottle and flooded the woman's abdomen with antiseptic. It wasn't sterile, but it was the best they had. "No cautery," Hale muttered, sweat stinging his eyes. "I can't burn the bleeders. We're going to have to tie everything." "I have the sutures ready," Ava said, holding up a packet she had ripped open with her teeth. "I'll retract. You cut." "Ready?" Hale asked. "Always," Ava replied. The surgery was a nightmare of shadows and slick fluids. Under the harsh, narrow beam of the headlamps, the world was reduced to a 6-inch square of skin. The elevator groaned and creaked in the wind of the storm outside, swinging slightly in the shaft. Every time it moved, Hale's stomach lurched, terrified the cable would snap. "Focus on the tissue," Ava whispered, sensing his panic. "Just the tissue. The world doesn't exist, just the layers: skin, fat, fascia, muscle, peritoneum." Her voice became a metronome, keeping him grounded. "Scalpel," Hale said. He made the incision. Blood welled up, dark in the dim light. "Wipe," Ava said, pressing a lap pad down firmly. Retracting. She pulled the muscle layers apart with her hands, acting as the metal retractors they didn't have. Her strength was unnatural. She held the abdominal wall open, unmoving, while Hale worked deeper. "I see the uterus," Hale said. "It's thin. Be ready." He made the final cut. Amniotic fluid burst out, soaking his scrubs. He reached in, his hand searching blindly for the head. "I've got the head," he grunted. "It's stuck. I need fundal pressure." "I can't let go of the retraction," Ava said. "If I let go, the muscle closes on your wrist." "Use your elbow," Hale shouted. Ava leaned her entire body weight onto the top of the uterus, driving her elbow down while keeping her hands hooked into the incision. It was a feat of physical leverage that defied physics. "Pushing," she gritted out through clenched teeth. Hale pulled. With a wet sucking sound, the baby slid out. Blue, limp, silent. Hale held the infant boy in his hands. He felt like he was holding a doll. "No tone," he whispered. "He's not breathing. Cord is wrapped twice around the neck." He clamped and cut the cord in seconds. He handed the baby to the nurse in the corner. "Stimulate him. Rub his back." The nurse rubbed the baby with a towel. "Nothing." "He needs air," Ava shouted. "Bag him." "The infant mask is in the kit, but the bag is missing," the nurse cried, panic rising to a scream. Hale looked at the baby. The golden minute was ticking away. Without oxygen, the brain damage would be permanent in seconds. "Give him to me," Ava ordered. She didn't let go of the mother's incision. She simply leaned her head down. "What are you doing?" Hale asked. "Mouth to mouth and nose," Ava said. "Old school." She took a breath, sealed her mouth over the baby's tiny nose and mouth, and puffed. Gentle, just the air in her cheeks. She waited. She puffed again. Hale turned back to the mother. "She's hemorrhaging. I need to close the uterus. I can't see the angles." The elevator shuddered violently. Dust rained down from the ceiling. "We're slipping," the guard yelled from above. "Get out. The brake is failing." "Not without the patient," Hale roared back. He was sewing faster than he ever had in his life, hand-tying knots in the dark, feeling the tension of the thread. He didn't care about the cosmetic layer. He just needed to stop the bleeding. Puff. Ava breathed for the baby. Stitch. Hale closed the mother. It was a race against the elevator cables. Suddenly a sound cut through the darkness. A sound sweeter than any symphony. A cough. A wet, sputtering cough. Then a thin, high-pitched wail. The baby cried. Ava pulled back, gasping for air herself. "He's pinking up," she whispered. "He's crying." Hale tied the last knot on the fascia. "Uterus is closed, bleeding controlled. We're done." "Get them up," Ava yelled to the guards. They passed the crying baby up through the gap first. Then together, Hale and Ava lifted the mother, groaning but alive, as the guards pulled her through the opening. Finally, it was their turn. Hale boosted Ava up. She scrambled onto the floor of the hallway. She turned back, reaching a hand down for him. "Take my hand, Mason," she said. She used his first name. Hale reached up. As their hands clasped, his surgeon's hand, expensive and insured, and her nurse's hand, rough and scarred, the elevator dropped. It dropped 6 inches with a metal shriek before the secondary brakes caught it. But Hale was already out, pulled onto the floor by Ava's grip. They lay there on the linoleum of the hallway, panting, covered in blood and sweat, as the emergency lights finally buzzed to life, bathing them in a dull red glow. Hale looked at Ava. She was wiping blood from her face with her forearm. She looked like she had just come out of a trench. And then he realized. She had. "You," Hale wheezed, sitting up. "You didn't learn that in a hospital." Ava looked at him. The adrenaline was fading, leaving her looking small and incredibly tired. "Aleppo," she said quietly. 2016. The basement of a bombed-out school. We didn't have power for 3 months. We did C-sections by candlelight. She stood up, checking her pulse, her composure returning like a cloak. "Dr. Hale," she said, reverting to formalities. "The power is back on in the ICU. The 15 minutes are up. We should check on Arthur." She walked away, leaving footprints of blood on the floor. Hale sat there for a long time. He looked at his hands. For the first time in his career, he didn't see them as golden instruments of a god. He saw them as tools, tools that were useless without someone to hold the light. He stood up. He had an apology to make. But more importantly, he had a lesson to learn. The sun rose over Chicago like a bruised peach, casting long orange beams through the glass walls of the St. Mercy Administrative Wing. The storm had passed, leaving the city washed clean, but inside the hospital, the turbulence was just beginning. At 8 a.m., the emergency department was calm, but it was the calm of a battlefield after the ceasefire. The night shift was signing out. The day shift was arriving, whispering in huddled groups, pointing at the elevator doors that were now taped off with yellow caution tape. Dr. Mason Hale stood outside the boardroom doors. He hadn't slept. He was still wearing his scrubs, stained with amniotic fluid and dried blood. He looked like a wreck, but he felt sharper than he had in years. He knew what was happening inside. The hospital board, the chief of medicine, and the director of nursing were in an emergency session. The topic: the incident in Elevator 4. To the administration, what happened last night wasn't a miracle. It was a liability nightmare. An unsupervised C-section in a stalled elevator, a nurse performing advanced surgical assistance, a non-credentialed airway maneuver on a neonate. It was a lawsuit waiting to happen. Hale adjusted his white coat, hiding the bloodstains. He wasn't going to let them fire her. For the first time in his career, he was going to put his own reputation on the chopping block for someone else. He pushed the doors open without knocking. The room went silent. 12 people in expensive suits turned to look at the disheveled surgeon. At the head of the table sat Dr. Sterling, the chief of medicine, a man who cared more about press releases than patient care. And sitting in a simple chair in the corner, looking small and serene in her fresh blue scrubs, was Ava Brooks. She didn't look worried. She looked bored. "Dr. Hale," Sterling said, his voice icy. "We are in a closed session regarding Nurse Brooks's employment. You are not required here." "I am required," Hale said, his voice raspy but firm. He walked to the center of the room. "Because if you are firing her, you need to fire me too. I performed the surgery. She assisted under my direct verbal orders. Every action she took was necessary to save 2 lives that your failing infrastructure almost killed." Sterling sighed, taking off his glasses. "Mason, we aren't questioning the outcome. The mother and baby are stable in the ICU. We are questioning the protocol." Nurse Brooks exceeded her scope of practice. She intubated a neonate via mouth-to-mouth. She engaged in surgical retraction. "We have liability protocols." "Liability?" Hale slammed his hand on the mahogany table. She diagnosed a splenic rupture from across the room. She identified Kawasaki disease when 3 hospitals missed it. And last night in the dark, she kept me from panicking and killing a woman. She isn't a liability. She is the best clinician in this building." He turned to Ava. "Tell them, Brooks. Tell them what you told me. Tell them about Aleppo. Tell them you have more trauma experience in your pinky finger than this entire board has combined." Ava looked up, a faint smile playing on her lips. She didn't speak. Dr. Sterling cleared his throat. He looked uncomfortable. He picked up a file, a thick, bound dossier that looked very different from the thin file Hale had heard about earlier. "Mason," Sterling said quietly. "Please sit down." "I will not sit down until—" "Sit down," Sterling barked. "We aren't firing her, you idiot. We're trying to figure out how to keep her." Hale froze. "What?" Sterling slid the dossier across the table. "We finally got her full credentials faxed over from the International Medical Corps headquarters in Geneva this morning. It seems there was a clerical delay in the background check because her clearance level is so high." Hale picked up the file. He opened it. His eyes scanned the first page, then the second. His mouth opened slightly. Name: Ava Brooks. Education: Johns Hopkins School of Nursing, valedictorian. Advanced Practice Certification: CRNA, Certified Registered Nurse Anesthetist, Trauma Specialist. Former position: Director of Field Operations, Doctors Without Borders, Syria, Yemen, South Sudan. Awards: the Florence Nightingale Medal, International Committee of the Red Cross. Publications: Austere Medicine, Surgical Interventions in Zero-Resource Environments. Lead author. Hale looked up, stunned. He knew that book. He had that book on his shelf. He made his residents read it. "You wrote the protocol for austere trauma?" Hale whispered, looking at Ava. Ava shrugged slightly. "I had a lot of downtime in bunkers. She's not just a nurse, Mason," Sterling said, looking at Ava with a mix of awe and fear. "She effectively ran the trauma infrastructure for the entire northern sector of a war zone for 3 years. She stepped down last year because—" Sterling looked at the notes, confused. "Because she wanted to return to the bedside and regain touch with the patient experience." Hale looked at her, really looked at her. The arrogance he had shown her, the 15 minutes comment, the assumption that she needed his guidance. It was laughable. She hadn't been asking for 15 minutes to figure out his ER. She had asked for 15 minutes to fix it for him. "Why didn't you say anything?" Hale asked, his voice humble. "When I laughed at you? When I treated you like a rookie?" Ava stood up slowly. The board members shifted respectfully. "Because, doctor," she said, her voice filling the room with that quiet, unshakable authority. "In the ER, rank doesn't save lives. Competence does. If I had waved my resume in your face, you would have respected the paper, not the person. I needed you to trust me, not my history. Because when the lights go out, history doesn't matter. Only the hands matter." She turned to Dr. Sterling. "I'm keeping my job then?" "Yes," Sterling stammered. "Of course. In fact, we'd like to offer you the position of nursing director for—" "No," Ava interrupted gently. "I'm the night shift charge nurse. That's the job I applied for. That's the job I want. I don't want meetings. I don't want budgets. I want 12 hours of patient care, and then I want to go home to my dog. Take it or leave it." Sterling looked at Hale. Hale nodded. "Take it," Hale said. "We'd be lucky to have her empty the trash cans." 3 months later. The weather at St. Mercy Medical Center had changed. It was no longer a place of chaotic storms and grinding drizzle. It was a place of rhythm. The shouting was gone. The ego-driven hazing of residents had evaporated. In its place was a culture of quiet, intense precision. At 2:09 a.m. on a Tuesday, the ER was full, but it wasn't loud. In Trauma Bay 1, a second-year resident was struggling to intubate a difficult patient. His hands were shaking. Dr. Mason Hale stood in the doorway. In the old days, he would have shoved the resident aside, taken over, and humiliated him. Instead, Hale watched. He saw the resident's panic rising. He stepped in, but he didn't touch the patient. He placed a hand on the resident's shoulder. "Breathe," Hale said softly. "Stop looking at the monitor. Look at the anatomy. You have time. Give yourself 15 seconds to reset." The resident took a breath. He adjusted his grip. He visualized the vocal cords. He slid the tube in perfectly. "Good," Hale said. "Secure it." Hale walked out to the central desk. Ava was there, updating the tracking board. The Ava Brooks effect had spread. The nurses were empowered. The doctors listened. The golden hour statistics for St. Mercy were now the best in the state. Hale poured 2 coffees. He placed one in front of Ava. "Black, 2 sugars," he said. Ava didn't look up from her screen, but she smiled. "You're learning, Mason." "I have a good teacher," he replied. He leaned against the counter, looking out at the waiting room. "We have a bus coming in. Multi-system trauma, 10 minutes out." Ava capped her pen. She stood up. She didn't rush. She didn't panic. She just checked her pockets to make sure she had her shears and her tape. "Are you ready?" she asked. Hale checked his own pockets. He touched the headlamp he now kept there, a reminder of the night the lights went out. "I'm ready," he said. Ava walked toward the ambulance bay doors as the sirens began to wail in the distance. She paused and looked back at him. "Doctor." "Hale?" "Yes, Nurse Brooks." "Give me 15 minutes to prep the bays?" Hale laughed, a genuine warm sound that made the nearby residents smile. "Take 20, he said. "We'll be right behind you." The doors burst open. The cool night air rushed in, smelling of rain and asphalt. The sirens grew louder, a crescendo of chaos coming to meet them. But inside St. Mercy, there was no fear. There was only the steady rhythmic beat of a team that knew exactly who they were, led by the doctor who had learned to see and the nurse who had taught him how.